This episode of Beauty and the Surgeon podcast is brought to you by Let's Get Checked. Let's Get Checked is an online company dedicated to making professional health testing easy and accessible. Let's Get Checked offers fast, affordable, completely confidential at-home health tests from a range of tests from STDs, male and female hormones, and even COVID-19. Listeners of our podcast who are new to Let's Get Checked get 20% off by using our URL, trylgc.com/beauty, and be sure to use the code BEAUTY20 at checkout. That's trylgc.com, trylgc.com/beauty, BEAUTY, and be sure to use the code BEAUTY20, BEAUTY20 at checkout. Do it. Getting tested is important. It's the responsible thing to do, and you know how important I think it is to make sure you understand your labs. Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy practitioner, and I'm joined today, as always, by the very crisp Dr. Martin.
I got very clean glasses.
Board-certified plastic and reconstructive surgeon.
Board-certified, and I can see.
I can see your eyes.
Yeah.
A lot of times you turn to look at me and I'm like, oh my gosh, it's like looking through a swamp.
I'm feeling pretty good.
Yes. So if you are listening to this podcast and you'd like to watch the slides and the video that go along with it, you can find those on YouTube at Jason Martin, MD. You can also find us on all social media platforms at Beauty and the Surgeon Podcast and at Jason Martin, MD. Today we have an interesting topic, and actually Dr. Martin was the one who said, why don't we do one about Botox?
It only took us 120 episodes.
To which I said,
probably the most common aesthetic procedure done.
Yeah, and I'm like, Botox? I'm like, we're going to talk about that for like half a second and be done. Like, it's Botox, it's great, move on. But then I actually started looking into it. I'm like, you know what, there is an episode here. So today we're going to talk about Botox.
It passed the Amy litmus test.
But there was enough to talk about. So without further ado, let's start off like we do all of our kind of procedural podcasts where we talk about the statistics. And these statistics come from the 2020 Plastic Surgery Statistics Report from the American Society.
Can you say that quickly, please?
Of Plastic Surgeons. Statistics Report. Plastic Surgery Statistics. It's not easy.
It's hard.
And in 2020, Botox injections, now this is again by board-certified plastic surgeons.
And this includes not just Botox, like all the other ones too, right?
Yeah, I think during this podcast, we should probably say that. We're going to use the word Botox to basically talk about all botulism.
Like when you say soda or Coke, you know, it's also Sprite and all the other things that go on. Yeah.
Yeah.
Same idea.
Right now.
Kleenex. Give me a Kleenex.
Tissues. Yeah.
There you go.
Mm-hmm. So when we say Botox, Botox is a trademark name. It is one type of injectable. There are others, Dysport and Xeomin being the other top two, but there are others as well. So
especially in Europe.
Oh, we're in Asia. Yeah. Asia's where it becomes crazy, wild, wild west of Botox or of botulinum injections. So in 2020, there were a little over 4.4 million Botox injections or treatments done. A little bit down from 2019 because none of us can guess why.
Did something happen in 2020?
I have no idea.
I don't know.
But it is estimated. I mean, if you look at the numbers from 20 years ago or 20 years prior, there were not even 1 million Botox treatments done by plastic surgeons. And now there's over 4.4 million. And that's just by plastic surgeons. It's estimated that it's closer to 7 to 10 million.
Yeah. And I read somewhere it's like 400 million doses of, you know, some astronomical amount of doses that were given.
Yeah. Because you think about this too, when you look at this number, primarily these are cosmetic Botox injections. And we will talk more about the difference between cosmetic and therapeutic use of botulinum toxin. So most of the other types of therapeutic use might use a lot more units, but are done by neurologists or other types of
They're done by lesser doctors than a plastic surgeon.
Not board-certified plastic surgeons. Yeah. So not a lot to say there. Botox is extremely common. So there was more Botox treatments done in 2020 than there were all other cosmetic procedures by plastic surgeons.
Combined, probably.
Yep. Oh, yeah. by a huge amount. Yeah. So lots of Botox. We all love Botox. So let's talk about what botulism or what Botox is. So it's a botulism toxin, which if you know about botulism, it's
not good.
It's real bad stuff.
It's like literally the most toxic substance that you can come in contact with on Earth.
Yeah, and it's common. It's in soil. It can grow on food. It's in the intestines
of animals.
Yep.
I feel like the story is in the 1900s there was like decaying.
Don't jump on my timeline.
Oh, okay.
Yeah, so we'll talk about the Belgian
I remember
funeral.
This from medical school.
Yeah,
you know?
We're not talking about.
And it was so funny. I'm old enough to be in medical school where they weren't talking about botulism as a treatment. So they were talking about it as a pathology that kills people.
Well, and it does. So botulism or Botox comes from the botulism toxin. It's produced by Bacterium Clostridium botulinum, which we call C. botulinum.
And Clostridium bacteria is like very much present in our environment. And we actually probably ingest Clostridium botulinum on a fairly common basis. So
very dose dependent.
It's dose dependent, but just because you ingest the bacteria doesn't mean you're going to get the toxin. The toxin only happens when it whatever germinates or whatever the cycle of that growth is germinate.
It's not germinate.
Okay.
Proliferate, grow.
I'm a smart doctor. Yeah. Anyways, part of the growth cycle, they produce the toxin, and also our gut can denature the toxin. I mean, you have to.
Well, the stomach acid. I mean, our stomach acid is the first line of defense against these types of infections.
Right. This is where all the moms are start to cringe because they're told not to give honey to a less than 1 year old child.
Right, because it could have trace amounts of botulism.
Right, and infants that 0 to 1 years old don't have the ability to knock out that Clostridium, and it can take hold and grow and then make the toxin.
Especially if they were not breastfed. Yeah. Mm-hmm. We go down a deep hole about breastfeeding and gut health of infants.
Right.
So in the wild, infection with the C. botulinum causes botulism. Botulism is an infection that paralyzes the muscles of starts off in the face, mouth, and throat before spreading to the rest of the body. Can lead to death when it paralyzes the muscles that are necessary for breathing. Interestingly, though, not everyone dies from getting botulism, and that will be key on our next slide. There are several strains and even more serotypes. There's actually 8 serotypes that are common.
I thought there were 7.
There are 8 because there's C1 and C2.
Oh, yeah. Got me.
And only A and B are used for clinical preparation. So of all the different kind of strains of botulism, and then from these serotypes, I mean, there's 45 subserotypes.
Oh, yeah.
I mean, there's so many, but it's only A and B. And that's why you'll hear on the ads, botulinum toxin A, when you hear that on the ad on commercials. I could so be a commercial.
It's so funny how the commercials make it sound so sweet, and it's literally the most toxic substance in the world.
This could literally kill you.
Yeah.
So there are only 2 that are used for cosmetic and or therapeutic uses. The rest are not.
Okay. Right. So this sounds really scary. Why would we inject this into our body, Amy?
Well, exactly. And I think that's where we need to kind of take a deep dive into the brief history of the botulinum toxin.
So I just find this very funny because people are going to be watching the YouTube channel, because they want to know about their Botox injections. Now they're going to get the history of botulinum.
Yep. Which it's very interesting.
It is so interesting, by the way. It's very interesting. So hopefully you'll find this entertaining.
I hope so.
Yeah.
I find it entertaining. I mean, with most things in anatomy, having taught anatomy and been really into anatomy, you learn very quickly that anatomists were real creepy dudes who were
totally creepy,
hitting cadavers with ice picks and doing all these other crazy things. And, the way we kind of came to our understanding of a lot of things in the human body are not super great. So the history of botulism is actually a little more interesting.
What was it? There was something I read about recently. You and I have talked about sterility and the understanding of the way that diseases are passed. Was basically that surgeons in the 1800s, after work, they would just go dissect bodies. Yeah. On the after hours, and that's how all these achievements and in this understanding came about. But it wasn't some glorified scientific study. In most of these
not
places.
at all.
I mean,
it was real weird.
Yeah, it was universities and stuff, but the way that they found these studies was very backhanded.
Oh, well, then even worse. I mean, you could get way deep down into the things they did on prisoners, and there's some real the way we came about many things in human history is not super pleasant.
Not good.
But the history of Botox or botulinum toxins is actually very interesting. So as Dr. Martin alluded to, there is going to be some food related things that happen here. But starting way back, I mean, and we go way back, primarily in a lot of the German cultures is where you saw it, that the king had actually forbidden the use of blood sausage. And there were some descriptions.
So blood sausage actually has blood in it?
It has blood in it.
Oh,
yep.
God. Even to this day?
Even to this day.
Oh, that's so gross.
Yeah. Blood sausage contains blood. That's why a lot of cultures won't eat it, ones who don't approve of consuming, those types of products.
Right.
So there was they didn't understand why, right? But then there was no real documented symptomology of this botulism infection until this, I love this, German poet and medical officer, because it was 1817 and you could be both a poet and a medical officer. Medical officer too, what does that entail? So this was Justinius Kerner.
Yeah.
He published the first accurate description of foodborne botulism. So actually described the symptoms and kind of the cause. But he didn't know what it was. He actually called it fat poisoning. He knew it came from the sausage that people were eating, but he thought it was from the fat content. Didn't realize that it was a foodborne bacteria. He was blaming the fat. So he called it fat poison. Yeah. Wasn't until 1869 that a German physician, John Mueller, much easier to pronounce, coined the term botulism from botulus, which was the Latin for sausage, where many of our things in medical come from. Yeah, so he realized that, all right, so this is why we call it botulism.
This is so funny.
Yeah, because the guy before him, Justinius, knew that it came from the sausage, but he thought it was the fat.
So basically what kills these people is sausage-ism.
Sausage poisoning.
It's sausage-ism.
Yes.
Yeah, I got you.
Yeah. So I think it's interesting, though, because so much in medicine comes from Latin. But like to have it come from the Latin for sausage.
I wonder, like all these terms we use, I bet there's a lot of other stories like that.
Oh, you know there are.
Yeah.
Yes. So fast forward a little bit more. We're up to 1895. There was a botulism outbreak after a Belgian funeral, Dr. Martin, that led to the discovery of the C. botulinum by Emile Marie van Ergenem. This I'm not
even trying.
Yep, professor of bacteriology.
But I do think the more names you have, like the more like names you have in your name,
4, 5.
the more like awesome and high class you are.
Yeah. So
we've all met somebody with like hyphenated names. They just seem special.
I think they just seem
pompous,
extra,
yeah, okay.
like problematic.
I kind of like
I think back to taking an SAT test. My little brother's name is Christopher, right?
Yeah.
My name is short. Amy is 3 letters. It's very easy. I could fill out my whole first name, my whole middle name, and my whole last name on the SAT boxes. He could never, because like Christopher didn't fit. His middle name was Michael. Like he was always having to like leave off parts of his name, and it drove him crazy.
Well, I have a friend who they have kids with no middle names, and I find that very odd.
It's like not having a belly button. That's
I
just
know
weird.
it's kind of weird.
Yeah,
and they just never got around to doing it. So
just couldn't be bothered. Like OBB, yo.
Yeah.
Like,
okay.
Name my kid Apple and move on. So this is what you were talking about. So this bacteriologist was able to trace back what had happened to this funeral person or this funeral party, whatever. And it came from the pickled and smoked ham.
Yeah, I knew it. It's always the ham.
There you go.
Yep.
So that's where it was actually kind of like, we kind of had the sausage poisoning, the fat poisoning, whatever. Like, and finally in 1895, we knew where it came from, and it was called botulinum.
Right, and you think about like the history of understanding microorganisms and infection. You got Pasteur, and this is, they have microscopes by the late 1800s, and
still don't have refrigeration.
Yeah, so they start to understand that there's pathogens in this stuff. Before then, they had no idea there was any like alive material.
Yeah, literally growing all over our skin at every moment. Yeah, it's crazy. So this was very common, right? There was no refrigeration. So pickling or smoking meat was very common. It may not be smoked at the right temperature. We all kind of understand how bacteria grows at not the right temperature. If it's never hot enough, if it's not get cold enough, like all these things can go awry. So that's where we were. So then we fast forward a little bit. It's crazy to think that this was not that far apart from 1895 to 1928. Seems like, you're making this drastic big jump from 18s to 19s, but that was like 30 years.
Yeah, 30 years. And, when you start doing that, it really messes with your mind. So like 30 years ago today was 1992, and then like Nirvana was like very popular.
Yeah.
That's stuff like that. Or like there was no iPhones.
There was no cell phone at all.
Well, there was the brick phones.
In 92.
Like the brick phones.
No, but they were still attached to a wire in a car.
It wasn't until like the late 90s that we had the flip phones. I remember that, and the small phones. And then Blackberries were the early 2000s. But like, it's just crazy. That's 30 years.
Yeah. Well, and even the Blackberry was more than 20 years ago. So not all that long, not all that far forward into the future. Researchers at the University of California reported that they had chemically purified the botulinum A into a stable light brown powder.
That's not good.
Right? That was water soluble, right?
Right.
So you could
research always starts with like these like glorious, affirmations, and then they put it into a powder and weaponize it.
Well, but they weren't. They were not trying to weaponize it. So what happened after like I mentioned previously on the last slide, was not everyone who gets botulism dies. Mm-hmm. And some people might stay paralyzed for a really long time, like months and months. Other people might only stay paralyzed for a little bit of time. Other people, it kills entirely.
Yeah.
So that's when researchers started to realize pretty early on that like, wow, if we could harness this ability to paralyze certain muscles, this could have medical purpose.
Yeah,
yes.
Medical benefit. Yeah.
So, but it was also unstable, and you can't infect somebody with botulism and hope they don't die, because they might be the one who dies. So there had to be a way to make it a dependable dose, right? A dose-dependent amount, and stable, so that you did not have a chemical weapon on your hands.
Right.
So fast forward a little more to the early or late 1960s, early 1970s. This is when Alan Scott and Edward Shantz started treating the ocular muscles in rhesus monkeys.
Okay, so ocular muscles means eyes, and then they talk about treating crossed eyes, which in the medical jargon is called strabismus. And, that is somewhat related to people with lazy eyes, the same idea. In strabismus or cross-eyes, like certain ocular muscles, eye muscles are overactive and they bring the eyes in. You don't have this stable placement of the globe or the eyeball.
Yeah, so like some muscles are pulling too hard. Same thing like with torticollis, and we'll talk about torticollis, like one muscle's overfiring essentially. Right. So that's what they started. So they started treating these monkeys, and I said, thus began the wild, wild west of aesthetic applications for botulism toxin,
right.
Botulism A. So Dr. Martin, you brought up an interesting thing about treating like blepharospasm, and that's kind of where it went to after this. So once they proved that they could do this and that didn't damage
so it
these
started
monkeys,
with cross-eyed or strabismus, okay? And then they are like, wow, this actually works. So by the way, how do you inject Botox or whatever the equivalent was at that time into an eyeball muscle? Like, that can't feel good.
Well, hopefully they put the monkeys under.
Well, I mean, at some point they were doing this to humans. So like, and kids are the ones you usually treat. So I would assume they would give them anesthesia.
Yeah, at least numb it.
So everyone has had this problem. So Nils, you've had this problem. When you like haven't had enough sleep and you had too much caffeine, what always happens? Your lower eyelid starts to fluctuate.
Yep.
And that used to happen all the time in medical school, which it's hilarious because in medical school, you're learning about every disease known to man. And every single one of us thought we had a brain tumor of some sort.
Because your eyelid was twitching.
Yeah.
I was told by a female relative at one point that was like basically like the nerves dying and I was aging.
Right.
As like an 8-year-old. So I would be like anytime this happened
like you
in
have
my
Lou
life,
Gehrig's disease. That was the second thing, or myasthenia gravis. That's what I thought.
Super paranoid.
So blepharospasms, there's some people that have this dystonia, that's the word we use, where the muscles fluctuate, and they do it a lot, and it's very disruptive, and it can be really problematic, not just like for them in presentation to go out in public, but just functionality in their eyelids.
Focus, it gets distracted.
So that's in the late 80s. Again, this is all off-label. They were using a Botox equivalent for injection of the lower eyelids, or the blepharospasm areas, which is the lower eyelids. At that time, can I tell this part, or is this in?
No, this is all you know.
So this is so interesting. At that time, a woman doing that, an ophthalmologist in Canada, and they have Canadian names, which I can never. Why are
What's
Canadian?
a Canadian name?
It's always French.
So you mean like a French Canadian name?
Yeah, French Canadian name.
Like
I don't know.
Francois.
Oh yeah. Her name
Angelica?
was Jean Carruthers. I guess that's not Canadian, right? That is kind of Canadian.
Carruthers?
Carruthers.
We have Canadian fans, and they're going to just love this conversation.
Yeah. So Jean Carruthers. I love Canada.
Canada's a real country.
I love our Canadian fans. Jean Carruthers. And she was an ophthalmologist, and she was injecting for blepharospasm. Her husband was a dermatologist. Now, he had a Canadian name, Alistair. Okay.
See, I would call that a British name.
Well, come on.
Alistair.
French
Very
Canadian. British Canadian. And he was a dermatologist, and she came home one day and basically said, I'm looking at my patients, I'm like injecting with this new thing, this Botox thing, and I noticed the wrinkles are less. They started doing a study, and they're the ones, the husband and wife, who came out with the idea to inject it for cosmetic reasons.
Well, they noticed this even on the monkeys, that their glabella lines went away.
Yeah. So we can talk about what glabella means, but I thought that's so interesting. So basically, it's pillow talk. The wife is like, these wrinkles are going less, and the husband's like,
dermatologist is like, dollar bill, y'all.
Yeah, let's go.
Yeah, so I think that was a pretty fascinating look at
that. Sounds like more like an
Botox.
American story,
What, Canadians don't like money?
No, well, okay.
All right. So hope you all enjoyed that brief history of Botox. We're going to take a quick break, and we'll talk some more about botulinum toxin.
We're going to get checked and then come back.
Yes. Dr. Martin, I'm super excited to talk about our sponsor for this podcast, Let's Get Checked. If you've been a listener of our podcast, you know that we have never had a sponsor before, and that's because we're an educational podcast. We're not looking to monetize, and we also would never recommend something that we didn't believe in and or use ourselves.
So basically, you're saying we're very choosy.
We're very choosy when we come to our testing, but Let's Get Checked really aligns with our values. We talk a lot about monitoring your blood values of certain things. We talked recently about vitamin D serum levels. We talk a lot about hormone levels, and it's hard for some people to get to a lab, or you're afraid of the blood draw, or just, you're concerned about confidentiality. Like, you have a lot of concerns and you just don't do it. Let's Get Checked makes it super easy because it's completely confidential. You do it from your home. So there's really no excuse not to do it.
Yeah, and we did it recently. Both Amy and I did it. She looked at her women's health
basically her hormone levels, and I looked at mine on the men's health side with testosterone. It was very simple. You go online. Their online interface is really easy to use and good. We got the testing kit very quickly. And the test itself, actually doing the stick, you do a stick on the end of your finger, is not hard to do. It only took about 3 to 4 minutes. You put it back in a sealed envelope that's confidential, goes back to them. You get your results in 2 to 5 days. It's really that simple. And the best part is it's about empowerment, about you taking control and trying to do things that are positive for your health and life. And this is one way to do it literally from the comfort of your own home.
Yeah, so they offer a wide range of tests. So they do men's and women's hormone panels. They do a full panel of STD testing. They also are now offering a COVID-19 test at home. So there are a lot of other just basic blood levels that you can get tested as well. And one of the things that we always say is you can't track what you don't check. So you might not know what's normal for you in the future if you're not checking it now, especially as it relates to hormones. And men's health specifically, I feel like is a little bit undertreated. I mean, sperm counts are dropping by a large percentage in men these days. Most men struggle at some point in their lifetime with low testosterone.
And those men do not know what the symptoms of low testosterone are. Depression, anxiety, sleep problems, osteopenia or loss of bone, loss of muscle, and something we treat all the time, gynecomastia or male breast growth. These are real problems that can be improved or treated with testosterone. And these men do not know their levels. It's so easy to get checked. And this is why we're so excited about the sponsor.
Yeah. And Let's Get Checked is a completely CLIA certified lab, the CLIA lab. So they're a well-established, completely safe lab to use. You do get contacted after, so you get your results. I got a text at 4:30 in the morning, which I loved, that my results were ready.
And we're both up at 4:30,
yep,
so that was good.
Super excited. And you have access to not only a nurse, but also a physician. So a physician does review your results, and it gives you a little breakdown of like where you're sitting on those levels. Dr. Martin's had even comparisons of like where 2 of the levels should be in relation to each other, which is a really important thing to note.
Right.
Just being within the normal range is not always enough. So it really gave more information than that. You'd still want to, of course, reach out to your own doctor if you needed some additional assistance with these labs or you did see something that was concerning. We didn't, thankfully, so that was good.
Yeah. We were both good. This podcast is about empowerment. It's educational. In my private practice, I'm a board certified plastic surgeon. We are all about empowerment, and this is one way to do it. So we're very excited about the sponsorship, and we're looking forward to using it for our patients moving forward.
Yeah. So as a listener of our podcast, if you're also a new time user to Let's Get Checked, which a lot of you probably are, we do have a 20% discount code. So you do need to go to our specific URL, and it is linked in the description box below, but it's going to be TryLGC, so TRYLGC, like Let's Get Checked.com/beauty, BEAUTY. And you'll need to use the code BEAUTY20 at checkout. Beauty again is BEAUTY 220. And you can pick a test, like any test you'd like, put in our code and get your test shipped to you. Getting tested is the right thing to do. It's let you know where you're at and what's responsible.
All right. Well, let's get tested.
Let's get tested. Let's get checked.
Let's get checked.
And we're back. Over the break, I was thinking, ham has taken down a lot of people. I mean, apparently this, right? Who was it? Mama Cass?
I feel like a lot of people died from ham.
Yeah. So watch out. Like, just avoid pork products. All right. So let's get back in our discussion about Botox. Now, this is what everybody came for, right? How does it, we know how it works, but how does it work in a human muscle and what can it treat?
Can I just say one thing real quick? So we talked about how really devastatingly toxic this toxin is. But just so you know, the toxin that we get in Botox is so diluted. It's at a power that's hard to even understand. Okay. So if you take a gram of botulinum toxin, that can kill 1 million people, right? So you take a gram, and I don't know, how do you equate to a gram, Amy?
It's a teaspoon. It's about,
a teaspoon.
Or 5 grams is a teaspoon.
Right.
So quarter of a teaspoon.
For every unit of Botox, it is diluted 10 to the negative 11th. So 10 to the negative 9th is nano. That means a billionth. And then you go further than that. So to put this in perspective, a piece of paper is 100,000 nanometers thick. Okay, you see how thin a piece of paper is. So a meter is wide. So it gets into a level that our human brains have a hard time understanding how diluted this is. The weight of Botox per unit is like the weight of a molecule, literally. So,
which is why it has to be reconstituted.
Right. So please note that you will not have any of these problems we noted in the first section of this. And I'm sure allergists, if they ever watch this episode, they're like, well, you had to start with the bad stuff first. Could you put the part about, people dying at the end?
Well, I mean, clearly if there were, 7 million conservatively 7 million just in this country of Botox last year and there were 0 deaths from it, I think it's pretty safe.
It's probably the safest thing we do.
Yes.
One of the safest, besides some of the side effects, which we'll talk about.
We will talk about those. So so you get this toxin, right? Like, what is it actually doing? So the toxin actually binds to a receptor site on the muscle. So muscles have these little microfibril heads, and they do this little like ratcheting motion where they clamp down and then they pull, and that's how your muscle contracts. Well, they block it. So they stop the head from attaching to the muscle fiber and being able to pull. So that's how it works. Stops the contraction of the muscle.
So acetylcholine is a neurotransmitter at the end of the at the neuromuscular junction where you have a nerve that comes in. It's sending an electrical impulse, which is called a impulse. And then it gets to I was like,
I don't know this.
Action potential. Yeah. Action potential goes across. Okay. And then it gets to the muscle where the muscle is.
And Botox goes.
Right. And it stops that from happening. Actually, the acetylcholine comes from the nerve. So I actually think it probably binds. Well, you can tell me. It probably binds on the nerve itself.
To stop the release.
To stop the release of acetylcholine. And that's irreversible. Okay. So when Botox gets to that area, and it's striated muscle too, by the way, the muscle that we control with our brain. We have 2 types of muscle, striated and smooth muscle, right, Amy?
And cardiac. There's actually 3. Cardiac is a subset of...
You and your anatomy background is so annoying. I'm the doctor.
Yep.
Okay.
And you are correct. There are 2 types of muscle, and there's also a 3rd.
Okay. Thank you. Thank you very much.
Yes, doctor.
That's how we run our
Yes.
office.
You are absolutely correct.
Okay. So the smooth muscle is like your intestines that work on the autonomic nervous system. They're always working.
You cannot with your brain tell them to work.
Like, I really want to digest this food.
I would like peristalsis to happen right now.
Whereas facial muscles, how do you say that word? Mimetic muscles of the face that move, right? You can control that. That's a striated muscle. Those have the neuromuscular junction that uses acetylcholine, the neurotransmitter, to stimulate the muscle to fire. And what happens is you stop the release of acetylcholine by putting in this toxin. It literally binds and it's irreversible, which is why this toxin in large doses is so problematic.
Yeah, there's no
because once it gets in there, you can't stop it. Right?
But it will eventually wear off.
It will wear off, yeah.
And that's why if you can make it through the initial phase of having botulism, you might live.
And the reason why it wears off, and this is the misnomer, all right? So hopefully estheticians and nurses and people that inject are watching this. It doesn't wear off because it's just working less. It works within 3 to 4 days and you're done, okay? What happens is over 2 to 3 months, you regrow these neuromuscular junctions, these synaptic junctions where the nerve goes to the muscle. And your body just does that naturally. So clearly, if you do Botox for 30 years, I know we'll talk about this, maybe your ability to regrow in those areas goes down and down. But it's not that the toxin keeps on working. The toxin works within 3 to 4 days and it's done. It just takes your body that long to recover and then regrow those neuromuscular junctions.
Yep. And some people do that quicker than others.
Yeah.
And you can also...
So when we talk about metabolizers, I actually think that's a misnomer.
Yep, I agree.
I was thinking about this.
It's very commonly said. They're like, I'm a fast metabolizer of Botox.
I say it. It's really probably that you regrow your neuromuscular junctions faster than other people.
Really quickly. Or your body has workarounds or like whatever. You maybe have more, the Botox doesn't bind to all your receptor sites.
Right.
Yeah. So there's a lot of reasons. So for FDA approved use of Botox or any of the botulinum toxins, we talked about the first 2, lazy eye or cross-eyed and blepharospasm. Blepharospasm. I always want to throw an extra L in there.
Yeah.
Blepharospasm.
Yeah.
Blepharospasm. Spasm. I just can't. Spasm is not a word.
It's just embarrassing.
Splasm.
We've been doing this for a long time and you can't say the medical words.
Spasm. I think maybe we need to make
there was a Saturday Night Live skit. That was one of the funniest ones I've ever seen. I think it's with Alec Baldwin. And he's a doctor that can't pronounce medical words. And he's like, I'm sorry to tell you, but you have canker. And I know this because I trained at Yali. Like, he can't pronounce any word. It's very good. Anyways, so in 2000, then it got approved for cervical dystonia, which is called torticollis. And
in babies.
You can see it in kids. And that's like an over pull of the sternocleidomastoid in kids. You see people with congenital problems. And then in adults, sometimes it can happen just randomly. Like 30 or 40-year-old females get this kind of torticollis. And
very painful.
Very painful. It's deforming. You'll see their heads are turned, like sometimes up or down.
Well, it's got to be down if
it's so great to see that on the podcast with me turning my head back and forth.
Me doing it like,
so you got to watch our YouTube channel. And so obviously injections in there would really help those people and loosen up the muscles.
Yep. So that was 2000. 2002. Here we go.
Let's go.
Glabella.
Let's go.
Your 11s. Let's treat those 11s.
What is the glabella, Amy?
It is the muscles in between your eyebrows. These little, like kind of almost fan-shaped little flat muscles that go up from either side.
One of them's called corrugator. The other one's called procerus. And you inject both of those. Those affect both the horizontal lines and the vertical lines that are present between your eyebrows, which we call the glabella.
And yeah, your 11s. Like that's such a common thing.
The 11s.
Or your furrowing between your,
Which I find very interesting because, well, we can keep on talking, but like that's all it was approved for.
Yeah.
You know?
I know, this is FDA. I mean, we'll talk about the off-label use, but this is your FDA-approved purposes.
Okay.
So 2 more years, axillary hyperhidrosis came along, and that is excessive sweating.
So clearly, acetylcholine doesn't just end in striated muscle, but it must end in glands or, secretory glands or things that cause sweating and problems like that. So they found, and I don't know how I didn't look at this research, but with hyperhidrosis or excessive sweating, they found that Botox is excellent in the armpit area and also on your palms. Yep. And let me tell you something, that's an easy injection right underneath the skin of the palms.
Well, it's easy for the person injecting it. It is not easy for the person having it. Yeah.
You better medicate for that one. Yeah.
It's a heavy dose. So like, again, dose dependent. So the amount that you need to like stop sweating is much higher than the amount you need to stop yourself from furrowing your brow.
But by the way, it really, really works. And it surprisingly, for the facial muscles, you get about 3 months. And then for the palms, you can get, what is it, Amy? I mean, for the axilla, up to a year.
Up to a year.
Yeah.
Yep. And that just shows how dependent it is on those areas of your body, like how quickly they are needing to change these nerve firing patterns. I mean, you think of the muscles in the face. I mean, so much like firing,
they're
so much activity.
A lot of stuff. And obviously the sweating component and the...
Not as much.
Yeah.
More of a parasympathetic function than anything. Yeah. So just the need for it to rejuvenate is probably lower. So in 2010, this one was pretty life-changing for a lot of people. They got the indication for chronic migraines and upper lip spasticity. So those 2 came in 2010. Migraines are very challenging to treat. We had a podcast episode many years ago with Dr. Lowenstein.
Which is on the YouTube channel. It is.
It is? Yeah. Yep. He has the head. He had the head with him. That was from 2018. That's an older episode. Probably in the 20s.
Yeah. Dr. Lowenstein. So he's an amazing plastic surgeon that does migraine surgery.
He's a board-certified plastic surgeon as well.
Yeah, based out of Santa Barbara. Anyways, I was reading this that it also mediates or affects the substance P and glutamine levels, which apparently those feed into the migraine problem. Okay, so I know that Dr. Lowenstein's going to say that you said that completely wrong, but meaning that the Botox injection doesn't just affect acetylcholine, it affects these other levels of these substances that can lead to migraine attacks.
Yeah, and we'll talk a lot about that with the off-label use. That Botox does a lot more than just this muscle firing connection. Urinary incontinence came in 2011, which again, pretty life-changing for people who have like bladder spasms. Very life-changing for them. And then finally, in 2013,
crow's feet.
We got crow's feet. We haven't even been a decade into crow's feet.
I know. And you think about like when Botox really started to hit its stride is right when I started practice, like 2006.
2002.
Yeah, well, 2002, it got approved. I remember that. But like, when things just get approved, people are like, it hasn't really gotten to its zeitgeist level. And that's when 2006 is when like the Real Housewives started or whatever. And they did Botox like on the 3rd episode. And before you know it, everyone was talking about Botox parties. And now it's just like universal. They don't really have Botox parties anymore. People everyone does. Even your dentist does it, So, but at that time, it was just kind of getting into the culture, 2006. So it's crazy that it took till 2013 before they approved the crow's feet.
Yeah. And that many off-label uses are still not approved. So, I mean, I could literally have multiple pages of slides for the off-label uses of Botox.
So this sialorrhea, which is excessive salivation. My dad, who has Parkinson's disease, one of the problems with Parkinson's disease is they don't have full control of their facial muscles. They tend to slobber, right?
Drool.
And drool, sorry. And that creates a lot of skin problems. It's really upsetting to the patient themselves. I mean, clearly, if it doesn't make you feel good, especially in Parkinson's disease, because a lot of times you have your full sensorium, like you know what's going on.
Yeah, you can look in the mirror and see yourself drooling and not be able to stop it.
And so they actually do intraoral injections. My dad had that, and it drastically changed his tendency to drool. So there's so many different things with perianal injections for fissures and people that have problems like that. That can be super painful.
Or even just for like sphincter dysfunction, like they can do that for people who have like anal leakage. I know these are like fabulous things to hear about, but Botox can help stop that.
It just this just really shows you two sides of the coin. You have the most toxic substance in the world and the thing that has, is there anything that you can think of that's had more of a benefit besides like insulin and stuff like that than Botox? It's treating so many different problems. Take away the cosmetic stuff, which actually has real benefit.
Yeah, it can treat, and there's a downside of the cosmetic use of Botox, which we've talked about on our episode about happiness, because people who overtreat or are very heavily treated with Botox don't have the appropriate social response to things, and then can therefore not teach their children those appropriate social responses.
I wish you would do more Botox, because most of the time you're looking at me with consternation.
Yeah. Well,
it makes me uncomfortable.
I would love to have more Botox.
I would like you to have a blank face.
A stone face. Yeah. Like stone lady.
Not an angry face.
So, like from a social perspective, like, is the use of Botox great? It definitely has its downsides socially, for sure. But I think it's interesting when you look at the off-label use, a lot of these are skin conditions. So alopecia is, of course, for hair. People are losing their hair. Why would that work?
Yeah.
Is it just slowing down the turnover of those cells, perhaps?
Yeah.
Psoriasis and eczema can be very, very challenging things for people to deal with. They have a pretty big, like, again, socially, when you have this like red raised rash all over parts of your body, it can be very insulating. You don't want people to see it. It can be embarrassing. So ironically enough, though, I've looked a lot about Botox and its use for acne, because you see this sometimes like, oh, Botox can be used for acne. Well, the issue is like it can sometimes help, but it can have the downside of causing overproduction of sebum in the same area that you've injected it. So it is absolutely not recommended for the treatment of acne right now, because when you inject it, it can actually cause it to be worse, because your body like almost like fights back and produces like more sebum in that same area. Vulvodynia is just kind of idiopathic vulvar pain that they don't really understand, like why it happens or what causes it.
With intercourse, obviously.
Well, but some women have it who are not
normally
sexually active,
so
or young people.
You can kind of loosen some of the muscles around there. So that makes a difference.
So
achalasia with swallowing. So there's something called nutcracker esophagus. I remember that from
closes.
Yeah.
Yeah.
Remember that from general surgery. You don't forget any of these things. Like, and where do I use this? Like,
it's still in there.
I know.
You're using it right now. It
just feels like, I wish.
Yeah.
I need to apply the same thing to cryptocurrency or something that's going to benefit me moving forward.
No one wants to know about your nutcracker esophagus.
No. You can't go to a party and start talking about a nutcracker esophagus. Anyways, it's an amazing array of off-label uses. It's pretty amazing. So
yeah, it can be used for so much. So there are risks and complications. Actually, before going to that, let's talk about one thing that I didn't mention on this slide, because it, again, is not only an off-label, it isn't anywhere near approval or even proven effective hypothetically just yet. So there are synthetic forms, like a synthetic Botox that has been tried to be made in certain countries, right? So like Dr. Moore was saying, like, was it really safe to inject botulism into your face? Well, like, yes, it very much is. But what if there was a synthetic that worked just as well? Well, the issue that they found with these synthetic botulism injections is they can also actually cause like necrosis and like muscle death. Like, they're not safe. They're not okay. So like, do not get any type of synthetic botulism injection. They are not safe.
So right now, Botox, what are the three types that are commonly used?
Dysport and Xeomin are the other two. And then there's the new one, Fenestra. Is that
Fenestra, yeah. The ones that are FDA approved. Yep. There's 4 of them right now. So, I think that you can feel very comfortable that you could use those injections and go to someone who is an expert and knows what they're doing and have a good outcome. Yeah,
but like topical Botox is becoming a thing as well. And the topical actually has shown some promise, especially in some of these topical skin conditions. It's not FDA approved yet. There are definitely, you can find it in other countries, but that is something that does show promise, but the synthetic versions should definitely be avoided.
Before you go to the next slide, do you have a slide that shows where we inject it and what we use it for cosmetics, or no?
No, I don't have like a facial diagram.
Okay, let's talk about that real quick.
FDA approved uses.
I know, but for cosmetics reasons, aesthetic reasons, are you going to show that?
No.
All right. So basically with Botox, it's used in multiple areas of your face, primarily, aesthetically speaking, to improve the appearance. So the first place would be around your eyes. It got first approved in 2002 for the glabella. Okay, that's your 11s, as Amy said, and the horizontal things. What's the name for that? The equal sign? I don't know. Whatever Allergan made up, their marketing team.
That one, I haven't heard Allergan make up anything for that.
It also works in the crow's feet area. It's an amazing use in this area. There's some muscle there called the orbicularis oculi muscle. It's a circular muscle that goes around your eye, and that's what causes the crow's feet. My crow's feet are terrible. Amy has no crow's feet.
Oh, I got lots.
And it's annoying, okay? I've worked with her for 10 years, and the woman has not developed any
10?
crow's feet. 12.
15
years. So it works really, really well on the crow's feet area. And also...
I would actually disagree with that. Okay, I would say it works.
I'm going to say the caveat. I know where you're going with this. We've worked through that. I know where you're going. It works well when you're not talking.
Yeah, without animation.
Without animation. But if you smile, and I will do this, everyone watch the YouTube channel and go like this, the other muscles get activated. Which ones get activated, Amy?
Primarily they're elevators in the cheek that are pushing your cheek up.
That's zygomaticus major and minor.
Like this.
Yeah, you need to write that down and use that in a normal conversation.
Think of like a little piece, they're little like peace sign muscles that are pushing.
Start commenting on
up.
people's zygomaticuses.
Mm-hmm.
How do you, zygomatici?
Zygomati.
Anyways, when you smile like that, it even if your crow's feet are knocked out, that's still going to be present.
That's the bunny lines too. Like there are muscles in and around your nose even that kind of contribute to some of those eye lines when you smile.
Exactly. Another area that works really, really well is the frontalis muscle or your forehead.
Which is surprising to me that that's not an FDA approved injection.
Right. I guess that's still off label.
Yeah.
Okay. Anyways, it works really well there. The frontalis muscle runs vertically from your hairline down to your brow. And there's two different strips of frontalis muscle, and they lift your eyebrow. And not everyone, but a lot of people hate those horizontal lines in your forehead, and Botox can treat those. Those are the three areas that are most common. And if you break it down in terms of units, like you go into some office, you're probably getting around 30 units. You can break down the number of units you use in each area and recommendations, but that's where you need to go to someone who really knows what they're doing and has experience. Other areas you can treat. She talked about the bunny lines on the nose. I don't know why people hate that. I
tell people is just don't make that
don't
face.
Like this crinkly
don't
nose
do
thing.
Again,
you
that.
Got to watch the YouTube channel.
Yeah, no, just don't do that.
You can treat that. You can treat around the lip, so people get vertical wrinkles in their lip. You can the orbicularis oris muscle, the muscle around the mouth. You can treat that.
That's minimally effective.
You can treat the chin. The chin, people don't like the creases in their chin and some of the lines that occur over time. You can treat that. You can treat the platysma muscles, the vertical bands in your neck. And I can keep going from there. These are the common areas you'll see. So Botox has a lot of indications in the face. The place that really works well, honestly, is between the eyebrows, the forehead for sure, and then less so the crow's feet, but it definitely helps there. So,
yeah, I think the further down on the face you get, the less effective it is, and the more you need to see the effect. We had a question. Well, I'll save it, but maybe in a future episode of questions from viewers, we had a woman asking about Botox for like some platysmal banding, and it's just not that effective. And at some point, it's just not that effective because there's too much else going on.
Right. The platysma muscle is the very thin muscle in your neck, and
like a strap.
Yeah, and it goes throughout your entire front of your neck. And it's always the muscle, I say to Amy, the muscle where you stick your lip out and you shave. And she's like, I have no idea what you're talking about.
No. Well, no, I said to a patient, I'm like, she doesn't shave. Like, she doesn't know how to do it.
You sure you don't shave?
He goes, like when you're shaving. And I'm like, she doesn't shave.
In my next life, Amy will just be a guy and we're just going to be brothers. But that's okay.
I know what you're talking about.
Yeah, okay.
Because
you see men kind of stick their neck out like that. And that's the platysma muscle. Over time, it tends to wrap around itself and form these vertical bands.
It's really thin. It's a super thin muscle.
And so if the idea is you inject the platysma muscle and those bands will be less grabby. They won't be clamped down as much. It's the same idea as cervical dystonia or torticollis. And it actually does work, but the problem is it doesn't work enough and people still have bands.
Yeah.
And what I do with the neck lift is I actually secure those bands together, create a corset, bring them to the midline, with an incision underneath your chin, and then you don't have to worry about them rolling on themselves and creating a vertical band.
Brings them back together.
Right. And I even divide those muscles at the bottom. So I think it's very, very interesting, and it's cool to do it with platysmal bands. We do it sometimes too, but we tell people, you know, they're really struggling with that, they're not young, you probably just need a necklace.
Yeah, like it'll soften it, but it's not going to fix this.
As opposed in the chin stuff and around the mouth with the vertical lines, none of this stuff gets rid of the problems there. You can do the depressors on the edge of the mouth to turn up the the edges of your lips.
See, actually, I think that works really well.
It does actually
that
work
works really well.
Problem is, if you over inject, you can have an asymmetry.
Yep.
So again, you have to go to an expert injector. There's so many different areas that you can use with Botox. I know I'm missing some, but it's fairly interesting, and also you can have pretty nice results that are achievable and replicatable. The problem is, well, she's going to get to it. It only lasts a couple months. That's why Allergan loves it.
That's why all companies who make botulinum toxin A love it.
Yeah.
That's why there's more coming to the market. So let's talk about the risks and complications, because it's not without risks. I think the primary thing that I always remind people with the risk of Botox is that your biggest risk is the risk of injection itself. Now, this risk would be the same whether we were injecting saline or Botox. It's not the Botox that makes the risk, it's the injection itself. It's the needle puncturing the skin. So that means infection, bruising, bleeding, pain. Those are risks of the injection itself, and those are probably the biggest risks because they're not avoidable. You're having an injection, there could be bacteria on your skin, like blah, blah, blah. You could bleed, you could hit a little vein or something and like cause bleeding.
Right.
That's just inherent in an injection.
Like bruising.
Yep.
We get patients that come in and they're like, oh, and by the way, you don't want to be taking aspirin. You don't want to be taking ibuprofen when
Fish
you get these
oils,
injections.
blah, blah, blah. But
anything that make you bruise or bleed more. They're like, and we ask them, are you doing? No, I'm not taking any of that. And then I forgot.
I take Celebrex every night.
Yeah, I took ibuprofen yesterday.
Took 800 milligrams ibuprofen
I took my systemic blood thinner yesterday. Well, like when I asked you before, so any kind of injection would cause that problem. So you could think in your mind, if you're going to get Botox, like probably if you go to someone who's expert and knows what they're doing, the worst thing that's going to happen, you're going to have some bruising in the area of injection.
Yeah, or there might be pain. But the real risks of Botox itself, or of these botulinum toxins, is the spread of toxic effect. So that makes sense, right? Like the injection you could get it in other places. So you inject it one place and the toxin spreads a little bit, so you have maybe paralysis of a muscle that you didn't want to be paralyzed.
So the common one for that is you're injecting the glabella, but between the forehead. Is there a layperson term for glabella?
I just say between the eyebrows.
Okay, where the 11s are. And the toxin kind of either because you didn't inject it right or just unfortunate circumstance kind of travels down to your eyelid. There's a muscle there called the levator muscle that lifts the eyelid that can result in ptosis or droopiness of the eyelid. You can actually give a medication for that. Amy, what's the name of that medication? God, it's been 12 years since we used it. It stimulates the Mueller's muscle. You remember that? It's a drop.
Yeah.
Anyways, I should have looked at that. That's okay. Don't worry about it else. It doesn't even matter.
Yeah.
Anyways, it's a Mueller muscle stimulator, and you give those drops with ptosis after a Botox injection. That can help, and that's good. The other thing you'll see what people talk about is you get it on your forehead and you inject it too much and it drops your brow and it creates heaviness.
Spikes it up.
Yeah, or the opposite. If you inject it around the crow's feet, which can lift your brows, you can go too high and get it like a Spock eyelid. So, there's not just, I guess that's not really a complication. Mm-hmm. It's just more of an aesthetic outcome you didn't want.
Well, that's more of, having like a overlifted or drop something, that's more of an injection issue than a spread of the effect. That's not the effect spreading. That's it being injected that way. So these hypersensitivity reactions are really things that could happen, again, from just a reaction to either the actual Botox. It could be the saline it was mixed in. Like you could have anaphylaxis, serum sickness, soft tissue edema, dyspnea. Like all these things can happen just because of like a reaction to the injection. Again, like to the injection. It could be the Botox, could be something else just related to the injection. There is actually a link between cardiovascular issues like arrhythmia and myocardial infarction specifically after Botox injections. They say that they don't really know that there's a direct, right? Because like, oh, maybe this was happening or the sun was in the fifth house or whatever, that like this happened on this day, but there is a definitive risk of that. Breathing difficulties, dysphagia, like, right?
Yeah, and a lot of these are not just related to the aesthetic injection of Botox, like dysphagia and breathing difficulties are for torticollis or injection in the neck. So it depends on the area of your body you're injecting.
Correct. And I'm assuming the cardiovascular issues are similar.
Yeah.
That they're using it for more major muscle injection.
Yeah.
Dry eyes, like Dr. Warren mentioned, like you can have some unusual effects happen. So if you spike somebody's brow really high and their eye isn't maybe closing all the way, or like something happens, their muscles are so deadened that they can't close their eye, you can have dry eyes after Botox. Talked about the risk of infection. Worsening of pre-existing neuromuscular disorder. Now, this is more on the therapeutic side again.
So you have to, again, you got to go to someone who is preferably board certified or like knows what they're doing. Like if you just get Botox at somebody's house, I mean, like buyer beware. Yeah. You know, we actually ask people, the clinicians that do this that are good at it, you ask people about their history, right? If someone has myasthenia gravis or some ALS or one of these like neuromuscular problems and you inject Botox, it could be a disaster, right? Especially if you're doing it for clinical reasons like cervical dystonia, right? So just the aesthetic version, you're not doing high units, but these other areas, you could cause serious problems to these people. So you got to go to real clinicians that actually ask you your past medical history. Again, I know this is not sexy, and the housewives of Orange County probably wouldn't have this conversation and ask the people if they're board certified or if they know what they're doing. But I do think it's important that someone actually sees you that understands medicine before they're going to inject you with anything.
Yeah, you can teach anybody to inject. It doesn't mean you can teach them what they need to know to do it safely.
Right.
Yeah. Double vision, again, like some of the issues of maybe some issues with the eyelid or something after, that makes sense. Headache, I would say that's probably the most common thing.
It's bruising or headache. And the headache's very short-lived, but it definitely can be there for a day or two.
Yeah, and a lot of it's because especially the first couple of times you have a Botox type injection, your body is trying, right? You're trying to contract these muscles and make these facial expressions, but your body's like, nope. But you don't know that, right? There's a little bit of a mind-muscle disconnect that's happening. So once you kind of relax and like it kind of takes effect, but at first it can definitely cause headaches of people like trying to fight it, I guess, like fight the Botox. Is once
I know I can do it.
Yeah, like I am gonna furrow my brow. Like
if I just concentrate hard enough.
I'm so angry. And numbness. I will say this, like I have an anecdotal experience with some issues with Botox injection somewhat recently. Hit a tiny little nerve and it was weird for a while.
Yeah, that was your supratrochlear nerve.
It was not numb. It was painful.
Yeah, I remember that.
And like super irritated, you know, and I've never had anything like that happen. And I thought that you were playing a trick on me.
Oh, that I was causing your nerve dysfunction?
No, like I thought, because I have my eyes closed, like I thought you were poking me in the head with the needle. Like I thought you were poking me like this. So the
needle went in and hit the little branch of the nerve and then shot the nerve.
So I started to like laugh and he goes, was that a weird one? I'm like, are you doing that on purpose?
Yeah, that's so funny.
Like, yeah, but it goes away. I mean, it's totally gone now. But for the first, like, I don't know, 3 weeks after, like even when I'd wash my face, the weird numb tinglingness would shoot all over that side of my face. It was really weird, but it goes away.
Yeah.
And that's the biggest thing is that it Botox goes away, right? We'll talk about that. Who's a candidate for Botox?
Anyone over 18 that has wrinkles or is afraid of having wrinkles. One of the big things now for Botox is its use for prophylaxis. What does prophylaxis mean, Amy?
Preventative.
Okay. So if you're in your 20s, theoretically speaking, and I actually kind of agree with this a little bit, you could inject Botox prophylactically, which would inhibit the formation of wrinkles, which we call rhytids. So my stupid ass crow's feet, if I would have started in training, you know, I was training to do this, and at the least they could have done is inject it prophylactically, my crow's feet, then maybe I would have been better off. Now,
I disagree.
No, well, you can disagree, but the reality is always somewhere in the middle, okay? It's not going to stop you from having wrinkles. Wrinkles don't just happen because you move your stupid facial muscles.
Right, it's not going to stop you from aging.
It happens because your skin thins with time. You get solar, sun damage. You don't live a healthy lifestyle. You smoke. I mean, you drink too much. I mean, we can get into this if you want, but in reality, it's one of many things that will lead to wrinkles, so it definitely will help a little bit. But anyone over 18 who's healthy, it doesn't have some of these contraindications, which is like what we talked about, Guillain-Barré or these other problems that people see.
Yeah. But even deeper than that, for therapeutic use, it's actually approved for use as...
Yeah, I'm sorry, that was cosmetically. And then in terms of medical usage, you could use it for torticollis, which is very common, not very common, but it can happen in young kids. And that's where the neck muscles cause disfigurement. You can inject those neck muscles, I think, 2 years old.
Yeah, FDA approved for 2, but I'm sure there are
They go
doctors
younger.
using it off
They
label,
go younger.
especially on newborns.
Yeah. And of course, you can't forget nutcracker esophagus.
That's
Amy.
right. Gotta treat that.
That could happen in many different people.
Yes. So at the end of the day, we call it vitamin B, and we love vitamin B.
Yeah.
I always tell people, like, best part about Botox is if you like it, like it's great. The worst part is if you like it, it wears off.
So Botox lasts about 2 to 3 months.
And some people it lasts longer. There are definitely people who it lasts even up to a year, and it depends on where you inject it and how much you inject. So if you inject like a lot in one little area, it might last longer than if you inject a little bit in that same area.
Right. You remember it's super diluted, so it's not even 10 to the negative 9th, it's 10 to the negative 11th. And only Nils' dad could figure out what that even means.
I was really hoping you were going to bring like a teaspoonful of.
You can't even, like, that's the problem with the human brain. We don't even understand what the hell I just said. I don't even understand it. I'm relatively smart, and I looked at it.
Well, we can't see it with. I mean, that would be, you can't see that with the human eye.
Yeah. So, it's very diluted. So obviously, if you inject more, then you're going to have a dose-dependent response. When you go in to your provider, hopefully it's someone who knows what they're doing. They're going to look at you and see the areas they want to treat. The number of units we use in each area is not standardized. That's where I think there
are recommendations.
There's recommendations.
Yeah.
But Amy, do you think, personally, do you think it matters who's injecting?
Oh, absolutely. I do.
Yeah, I really do too.
I've seen some really bad things.
Because you could inject 10 units incorrectly and it doesn't do anything, or you can inject 4 units and it makes the biggest difference. I tend to do only 25 units to treat the glabella, forehead, and crow's feet, and my patients tend to be really happy with that. So 25, 30 units, and that's not a lot. I mean, there's certain places primarily inject 50 units.
Oh, well, now you watch TikTok videos of people having like 100 plus units injected all over their face.
Right.
I think that's where you start to see, like, is this really helping?
Yeah, and you think about when you go into these offices, are they injecting Botox because they're trying to be philanthropic? I mean...
Right. They're good deed doers.
Right. They just want to help you out.
Try to make the world a more beautiful place.
No. I mean, every unit equals what, Amy?
Again, the Canadian dollar.
Yes, the dollar. So
do they even use, what do they use? What is Canadian money?
Do they use dollars there? No?
No. They have dollars.
Except for their one, which is a loonie.
A loonie.
Okay.
Well, there we go. Some loonies.
So, it's always that balance. I think if you could give advice to somebody, because Botox is really common and people are very interested in it, go to an office that's either established or has injectors there that know what they're doing. I know that Botox is a commodity and people try to group on it all the time. And I get that, right? I mean, because everyone wants to save money, but it's really nice to go to someone who knows what they're doing, that can have a treatment plan that actually makes sense and treat the muscles that are the problem. Secondly, it's nice to go to someone who understands where the muscles are.
Well, like you said, how to inject.
But also,
30 units from one person is not 30 units from someone else.
I could teach my 14-year-old son how to inject something into the skin. And I could say, this is where the corrugator muscle is. And he'd be like, all right, whatever, corrugator. Okay,
yep,
that's good.
This is what he said.
Right.
Frontalis.
Right. And I have the benefit of actually, I have seen the corrugator muscle and frontalis muscle in live patients. I've seen the frontalis muscle when I do a brow lift. I've seen the orbicularis oculi muscles around the eyes when I do blepharoplasties. I know those muscles. I know how thick they are. I've seen them from the top, seen them from the bottom, seen them from up, down, and to the side.
I've seen them when they've gotten sliced entirely through.
Exactly. I've seen it from traumatic injuries and otherwise. So, it's easier for me than I can be a lot more comfortable around the face. And that's facial anatomy comes from experience. And experience comes from going to an office that hires people with experience, or at least has a team of people. At the very least, there's someone experienced at the top teaching everyone else how to do this correctly. That's really, really important.
Well, and they're to address issues because, as we showed, there can be issues with Botox.
Right.
And they can happen to anybody.
And it's not like the issues are going to be safety driven, maybe all the time.
Well, unless you're getting a lot of infections from your injections.
Right.
That's
and that's usually probably something related to the patient. It's more about dollars spent. If you want to save $50 and go to someone who sucks, okay, you could go spend 50 more, go to an expert, and probably have a lot better outcomes you would ever get, even if the $50 less.
Oh, you're probably paying double.
You know what I'm saying?
Yeah.
You're not. And there's a whole other side to this that gets even more problematic is, are you really getting the dilution of the Botox that they say you're getting? Think about it. If you go to an office that's Grouponing and everything's the lowest number, do you think that they're mixing that stuff? I mean, seriously, right? They are all about making that bottom dollar, and every little half a unit counts. Whereas you go to an office like ours, you're going to pay more, but I'm not looking at the vial to see how much I'm making. I'm looking at your face, deciding a treatment plan. I actually talked to you about your past medical history. Amy talks to you about post-injection care. We sign a consent. How do you say that word?
Consent.
Did I just say that like I'm from Kentucky?
That one I know. Consent.
A consent. And, and you go from there. So the point is that I know people want to treat this as a commodity, but try to go to someone with experience that you can trust, that you know that they're mixing the Botox with what they're saying. You're getting the amount of units you're getting charged for. And also they can follow you in the future. Yeah. Sometimes even in our office, people will come in, I'll do the injections, I'll write down what I did, and they go somewhere else and they just pass the piece of paper over.
Well, but that doesn't translate. Like
at the very least, they have a roadmap of where to stick it. So.
Yeah.
Where to stick it, I know.
I mean,
that's what she said.
My point is that doesn't work for everybody.
Yeah.
So then again, if it goes wrong and you have a weird Spock eye, it will eventually wear off. When I used to actually watch like regular television and I'd watch the news, I would always look at like the newscasters who had really bad Botox. Like they either had stone face so bad it was disturbing, or they had like one freaky eye. I'm like, but you know, it goes away. And unfortunately though, it might take a while because.
Right. And that is the real balance. And this really does get in the expertise thing. And it's okay. Like Amy and I totally understand if you're somebody who wants a paralytic face, totally frozen.
Those people are out there.
And that's okay.
Mm-hmm.
That's weird, but that's okay. Like that's your prerogative. You can find an office that does that. But in reality, most people want to be able to still move their facial muscles.
Well, or like cry or show someone that they're happy.
Some emotion.
Yeah.
So go to a place that's going to not over-inject you, right? It's going to do it systematically and correctly with good technique. Going to do it hygienically, clean your face off, et cetera, all these things to do it correctly. And you're going to be happy with the outcome. It's a relatively safe procedure. It's weird to say that knowing where it comes from and all the history we talked about, but it's something that I think, it wouldn't be this popular if it didn't work. If people didn't.
Oh, it works.
Yeah.
Yeah.
We both like it.
One thing we did not say is there are people who develop antibodies against it, even though it's such a tiny amount of the botulinum. There are people who develop antibodies, and it is ineffective on. So like there are non-responders.
Yeah, I've never read an article about that.
Yeah, there actually are. Okay. There are people who.
Did you actually read that, or is that something you dreamt?
No, I actually read that. I did not dream that. My dreams are way more twisted than that. Yeah. So you can develop you can be like a non-responder to Botox. That does exist, and if that is the case for you, I really do feel bad for you because we love Botox.
Yeah.
So
we're pro Botox in the appropriate office with the appropriate expert.
Yep, we love Botox. So thank you all so much for listening to this podcast. If you're interested in finding us on social media.
See, that wasn't that bad. That was pretty interesting.
I told you it was very interesting.
Yeah, I know. Like the whole history of it and stuff. Hopefully people watch that.
And are afraid of ham forever.
Yeah.
And blood sausage.
Exactly.
Actually, blood sausage is not so bad, but yeah, you want to make sure you get it prepared correctly.
I'm sure Nils has had it.
Social media below. You can also leave us a voicemail at 303-630-9038.
Have you been getting any voicemails lately?
I actually did get a voicemail, a very interesting one. The person noted that we do not have a lot of people of color on our website and thought maybe we don't have any patients of color, which it's not the case, but we don't have a ton. So if you are listening to the end of this,
That's actually very apropos.
It is. And that just shows what part of the country you're into.
I know, but we also have more patients of color than most practices in this area.
Yep. And if you look at and that's why I said this, if you look at our Instagram, we actually have a lot of pictures of people of all types of nationalities.
Yeah.
Hispanic descent, African American, like we have a lot of.
Yeah, we have a lot more.
Variety, but on our
website.
Put it
on our website.
Yeah, it's a little different. So.
Yeah.
Yeah.
Interesting.
So we have gotten voicemails recently, and I do appreciate all of them.
I love those kind of comments.
So please leave us a voicemail. We would really appreciate if you would share us with your friends. Leave us a like, a comment, a rating, a review. It really does help. I think our podcast has a lot of value, even if it's just telling you that the freaky ham from the 1800s was probably not safe to eat, but it did help you develop no wrinkles in the year
where else would you find out that the ophthalmologists and the dermatologists were pillow talking about the benefits of a strange toxin they were injecting in people's eyes?
That was bound to happen.
I know.
All right. Thanks everyone so much for listening, and we'll hear you next time.
I would show my expression of leaving, but I can't because I'm so frozen in the face.
All right, frozen face. Don't forget to check out our sponsor, Let's Get Checked. Let's Get Checked offers fast, affordable, and completely confidential health testing for everything from STDs, male and female hormones, and even COVID-19, right from the comfort of your own home. And remember, new customers and listeners of our podcast get 20% off by using our URL, trylgc.com/beauty, and be sure to use the code BEAUTY20 at checkout. That's trylgc.com/beauty and use the code BEAUTY20, beauty, BEATUY 20 at checkout. Get checked. It's the right thing to do.